My name is Serene.
Hi, my name is Jonathan.
Welcome back to our channel. Previously, we released some videos to show that Mr. Gu's Taoist exercise help to clear the blood vessels. Today, Jonathan is going to use the concept of blood vessel sweeper exercises to introduce a set of methods that can cure constipation, even for stubborn cases. First of all, Jonathan,
Yes.
what is the condition of constipation?
Constipation means infrequent or incomplete bowel movement. According to conventional medicine, a patient must experience at least 2 of the following symptoms over the preceding 3 months. Fewer than 3 spontaneous bowel movements per week. Straining more than 25% of defecation attempts. Passing lumpy or hard stools for at least 25% of defecation attempts. Sensation of anal obstructions or blockage for at least 25% of defecation attempts. Sensation of incomplete defecation for at least 25% of defecation attempts. Maneuvering required to defecate for at least 25% of defecation attempts.
It sounds like even you have a bowel movement every day, but during the process, you have to push hard, or the feeling is not complete. Then this is all considered constipation. I have read a research that shows 1 out of 7 people have the symptoms of constipation.
Yes, there are so many people suffering from this.
We know that this is not just a problem of the digestive system because the accumulation of toxins and poor nutrient absorption can make people feel tired, dull skin, emotional instability, bad breath, increased blood pressure, or increased eye pressure caused by strong pushing of stool. Therefore, people with constipation symptoms should take it seriously.
Indeed, some of my patients have used stool softener for so many years to defecate it, and some people need using their finger to remove their dry stool.
That is very painful and troublesome.
Today, I would like to tell you about the cure for this kind of stubborn constipation. There are 3 keys of the constipation solution: blood, nerves, and lubrication to help intestinal movement. First, blood. When the blood circulation in the intestines is impaired, this area can shrink or dry because of a lack of nutrients. This makes it difficult to pass the stool. Through exercise, we make the blood vessels in the pelvic cavity have sufficient blood and pass the blocked blood vessels so that the intestines are nourished and elastic, which is helpful for defecation. We will demonstrate later. Second is nerves. The smoothness of nerve conduction also affects the peristalsis of intestines. Activation of the nerves in the pelvic cavity is even more critical. Acupuncture points are homeostatic. The suppressed nerve can be excited, and overly excited nerve can be stabilized. In addition, the local blood helps restore the function of the nerves. This stimulates and restores elasticity, which is helpful for bowel movement. The following 2 movements are to help the pelvic cavity have sufficient blood and stimulate the nerves. They are also the 2 basic movements of pelvic blood circulation exercise. In the first movement, the joints of 2 fingers are placed on the buttock. The center of the buttocks is the position of the sciatic nerve, where the nerves are abundant and strongest. The sciatic nerve passes from the pelvis to the foot, which not only excites the pelvis but also communicates with the legs and feet. We need to connect the nerve first, and the nerves need blood to nourish. So we must do this exercise till body feels warm. When doing these movements, start slow to warm up and then move faster which may feel like the blood is rushing to the head. Some people ask me, should I stop when I feel the heat rushing to the head? No, if you have energy, keep doing it, and slow down when you are tired. When you are ready, continue with faster movement again. This is like washing the clothes with warm water. Rolling for 2 minutes is different than rolling for 10 minutes. Of course, rolling for 10 minutes is cleaner. It is the same for cleaning the blood vessels. The generated heat does clean and unblock blood vessels better. Do the faster movements at least 3 rounds in a minute. The second movement uses the energy from the center of the palm. Put the both palms on the ovaries or prostate area. This will not only treat constipation but support prostate or ovaries to balance our hormones. Hormones are very important to stimulate the body's function. This is also building up the foundation for the next movement. If you want to treat constipation, using the above 2 movements already very sufficient. Please do it twice a day, each time 1 minute. Make sure you can feel the warmth in the body, at least doing the fast movement 3 rounds in that minute. If you have more stubborn cases, the next move is very important. Please keep watching. The third one is lubrication. In patients with chronic constipation or stubborn cases, the intestines are dry, not very peristaltic, and the stools are hard and dry. At this time, it is important to have enough and appropriate fluid into the intestine. The intestine wall and the dry stool still sticking together. Using specific movement to do the vibration to shaking it, helping the water easy going through between the dry stool and intestine wall. It helps to squeeze out the stool without cause intestine wall bleeding. After do the previous exercise for 3 days. On the day 4, please drink 3 cups of warm whole fat milk on an empty stomach. You also can choose soy milk, almond milk, or honey water. Wait for a few minutes. Put the hands on the lower abdominal and shake vigorously. Keep your legs straight. Lock your knee and stomp your feet in place. After you finish this, please drink another cup of warm fluid and repeat this movement again. Second, held the column movement exercise. In the sitting position, bring your left knee and cross it over the right knee. Clasp your hands over the knee. Place the crown of the head up and elongate the spine. Tuck the chin. Raise the pelvic floor. With a straight spine, bring the torso forward. Strong pull the knee toward the body, which works on the lower part of descending column. Let's see from different angle. And we switch to the other side, which work on the lower part of ascending column. In the sitting position, bring your left knee and cross it over the right knee. One hand on the outside of the knee and one hand on the inside of the lower leg. Press the crown of the head up and elongate the spine. Tuck the chin, raise the pelvic floor, push both palms toward the center, which works on the upper part of the descending colon. Let's see from the other angle. Now we switch to the other side. This works on the upper part of the ascending colon. Keep feet flat on the floor, shoulder width apart. Place both hands on the outer thighs. Press the crown of the head up and elongate the spine. Tuck the chin, raise the pelvic floor. Bring your torso towards your sides. Bring the knee together, which works on the transcending colon. Let's see from other angle.
The methods that we share with you today are all effective ones that Jonathan has used clinically. We believe that as long as you regularly practice this for 7 to 10 days, you will see the great results. Please leave your comments below.
If you like these videos, please click like, share, subscribe. Thank you so much. See you next time.